Labeling is the most critical part of any facility's QA process. All preparations must be labeled accurately for safe administration of medicine, and labels should be easy to read and understand. In this section, we'll review labeling. Labels contain the information technicians need in order to compound medication. For the safety and welfare of patients, it's important that correct information be printed on labels. Just as importantly, you must read, interpret, and calculate doses correctly based on that information. Pharmacy technicians may detect errors in an order, on a label, and in other documentation. A pharmacist should always be alerted to suspicious information that a technician has found in an order, on a label, or as part of a medication calculation. Because of the critical nature of the information, each person is responsible for checking the previous person's work. Let's take a look at general labeling guidelines. Drug labeling is required if the preparation is not administered immediately, or if it is administered by someone other than the person who prepared the medication. Labels must conform to all applicable federal, state, and local laws and regulations. In order to ensure proper labeling, follow these guidelines. Type or electronically print medication labels in a standardized format to ensure that they are legible, accurate, and complete. Make sure that the appropriate primary and auxiliary labels are firmly affixed to the container. Use a metric system of measures instead of the apothecary system. Do not use numbers, letters, coin names, unofficial synonyms, and prohibited abbreviations to identify medications, with the exception of approved letter or number codes for investigational drugs. Destroy all medications with illegible or worn labels. Use a uniform systematic labeling method. Fill and label one order or drug preparation batch at a time. Dilutions and labeling should be done in the pharmacy whenever possible. Within the pharmacy, only a pharmacist or authorized pharmacy technician under the supervision of a pharmacist may label and dispense medications, make labeling changes, or transfer medications to different containers. Now, let's review the USP labeling requirements for compounded sterile preparations. With the introduction of the United States Pharmacopoeia's Chapter 797, a minimum labeling standard for all compounded sterile preparations now exists that applies to all healthcare settings, not just pharmacies or hospitals. Here is a sample label showing the USP label requirements. Section 1 includes the names and amounts of the concentrations of ingredients. The name of each drug is clearly shown. This includes the names of all drug products or ingredients added or used to prepare the finished preparation, including admixture solutions and corresponding volumes. While the label information should contain the generic name of the drug, the trade drug name or commonly known name of the preparation can be included if it might reduce the potential for error. Although the amount of admixture solution is usually unimportant in the patient's therapy, it may be a consideration in certain clinical settings. More generally important, the admixture solution affects the compounded preparation stability and beyond use dating. In some cases, it may be appropriate to label ophthalmic sterile preparations with the concentration, not only the active ingredients, but also the preservatives. Moreover, the amount and units of measure should be standard and easily understood. Section 2 displays the total volume of the preparation. The total volume of the preparation is usually expressed in the metric system. For IV piggybacks and continuous infusions, this measurement allows tracking the patient's total fluid intake. If the volume of the admixture solution is not significantly different from the total volume, for example, with antibiotic solutions, these measurements are used interchangeably. For large volume solutions with multiple additives, such as TPN solutions, use the actual or calculated total volume. For syringes and vials that are overfilled, both the overfill volume and the volume of the prescribed medication dose should be clearly shown on the label. Section 3 includes the beyond use state. The beyond use state is the last state that the preparation can be used by the patient. Beyond use dating should be based on known stability information and sterility considerations. The specific beyond use date of a preparation should be based on published data, appropriate testing, or USP NF standards. Section 4 shows the appropriate routes of administration. Even though the route of administration may be implied by the dosage form, place the appropriate route of administration on the preparation's label. Remember, some drugs can be given only by certain routes, or the amount concentration is route specific. Clear clearly mark and label preparations used for irrigation, cardioplasia, intrathecal, and epidural injections, and peritoneal dialysis by size, shape, and the use of auxiliary labels. Syringes should be clearly labeled with the intended route of administration. This is critical, as in some cases the ramifications of giving a particular drug or dose by an unintended route can be fatal. Section 5 contains storage conditions. Storage instructions can be put on the primary label or added as an auxiliary label. Finally, Section 6 provides other information for safe use. Other information, including cautionary statements for the safe use of the preparation, can be put on the primary label or added as an auxiliary label. This information should include the initials of the pharmacist who prepared or checked the preparation and complete directions for the proper clinical administration, including device-specific settings and instructions. In addition, hazardous drugs should have appropriate precautionary labels to facilitate safe handling, use, and disposal. For facilities that ship preparations outside their own facility, disposal instructions for out-of-date or unused units should be included. Next, let's look at patient-specific labeling. In addition to these minimum labeling standards, patient-specific compounded sterile preparations have additional requirements when used in institutional and/or home care settings. Accurate labels not only help staff efficiently deliver preparations, but also supply needed information to staff or patients and caregivers to safely administer the correct medication to the patient. Section 1 includes the patient name and identification number. A patient name on a label defines the dose as ordered for the patient. Exclusion of a name can lead to errors. Identify both the first and last names of the patient, and ideally, a middle initial. In addition to the patient name, a medical record number or account number also identifies each patient in most hospital computer systems and can serve as a second unique identifier. This number is especially critical to drug administration in hospitals that use barcode technology. Section 2 displays the patient location. A patient's location information within a treatment facility ensures that the drug gets to the correct patient. Transfer or discharge of a patient also should be tracked so that the label information is updated. Without accurate location information, delays in therapy and unnecessary work can result. Section 3 shows the name and amounts of drugs added and the name of admixture solution. This section is similar to Item 1 on the USP label. However, it includes the names and amounts or concentrations of the drugs added to the compounded sterile preparation, as well as the name of the admixture solution used in compounding the sterile preparation. Identification of the admixture solution makes the label more complete and accurate. Section 4 gives the approximate final total volume of admixture solution. This section is the same as Section 2 on the USP label. The total volume should be listed for all preparations, including intermittent and continuous IV admixtures, critical care infusions, total parenteral nutritional fluids, irrigations, dialysate fluids, and small volume sterile preparations, such as syringes. Section 5 shows the time and date of scheduled administration. In institutions, the scheduled administration time is generally referred to as the due time and is expressed in military time. This information notifies the nursing staff of the administration schedule maintained in the pharmacy. When admixtures are in an improper sequence, the oldest one, that is, the one with the earliest expiration, may not be administered, which creates waste. Institution-specific standardized administration times also reduce the confusion and prevent omitted doses. Section 6 includes the time and date of compounding. The time and date of compounding are needed to determine actual beyond use times for recycling preparations. In addition, JCAHO requires the prepared date for all compounded IV admixtures and parenteral nutrition solutions. JCAHO also requires beyond use time for all preparations with beyond use periods less than 24 hours. This information may be contained on the label, even if it is not stated clearly. For example, the scheduled administration time may indicate when a drug was prepared based on that sterile preparations batch or fill list period. Section 7 includes beyond use date and time, if applicable. This section is similar to Section 3 on the USP label. Traditionally, in an institutional setting, The expiration or beyond use date assigned to a preparation is the actual time that the medication is considered unusable by the patient. The beyond use date might also be a standard amount of time in which the medication should be returned to the pharmacy. After it's returned, the pharmacist can determine if the preparation should be recycled or discarded. For compounded sterile preparations with beyond use periods less than 24 hours, a beyond use time is also required. Section 8 shows the route of administration. This section is the same as Section 4 on the USP label. Section 9 gives administration instructions. This section is similar to Section 6 on the USP label. However, it includes all directions needed for proper clinical administration of the preparation in an institutional setting. For intermittent doses, include administration instructions with the duration and rate of administration. If the preparation requires activation or some other manipulation prior to patient administration, this information should also be included on the primary label or added as an auxiliary label. For continuous infusions, administration instructions generally include the rate and possibly a stop time. The rate should not be included for a continuous infusion if the drug is being titrated, because the rate may change. In these cases, directions such as infuse as directed or titrate may be more appropriate. Now let's talk about the batching process. Batching is the process of preparing multiple drugs that will be needed during a specific period of time. The process is as follows. A setup technician collects drugs, records, labels, and other items that are not stored at individual workstations and will be needed to batch a certain preparation. The collected items are placed in a bin and left on the setup counter, ready for a technician to take to a laminar flow hood workstation to compound. After gowning up in proper cleanroom attire, you will retrieve a bin at the setup counter and proceed directly to a laminar flow hood workstation. To keep the items used for compounding as sterile as possible, you should not leave the workstation until the batching process is completed. With careful estimation, the Minibag Plus and Advantage IVs can be prepared in batches. Accurate estimation is necessary in order to limit waste due to the 30-day expiration that begins as soon as the attached drug is added to the suspension fluid bag. Medications compounded in piggyback IV systems and drip IV containers can be prepared in batches. But depending on the drug used, the processes, labeling guidelines, documentation for records, and expiration dates may be different. We will now discuss auxiliary labeling. Auxiliary labeling provides supplemental instructions and/or precautions similar to Section 6 on the USP label, without the space limitations of pre-formatted or computerized labels. Auxiliary labels have an added advantage of highlighting the information, since the label looks different. Auxiliary labels also can help staff follow the manufacturer's recommendations and/or the pharmacy's guidelines for storage of all medications prior to distribution. The same auxiliary labels should be used each time a particular sterile preparation is dispensed. Otherwise, users may question the importance or validity of the information. Auxiliary labels are often used for information about light protection, final filters, rate precautions, storage conditions, drug concentration, routes of administration, and other information for safe use. All information for the safe use of the preparation is now required as part of the labeling, either on the primary or auxiliary labels. Finally, let's discuss the importance of expiration dates. Expiration dates provide information that alerts pharmacy workers when medication loses its desired strength or potency. Expiration dates differ depending on the drug and the environmental conditions in which they are stored. When the drug is expired, the medication must be taken out of circulation to ensure patient safety. Within the pharmacy, only authorized personnel may label and dispense medications, make labeling changes, or transfer medications to different containers. Patient-specific CSPs have additional requirements for use in institutional and home care settings. Batching is a process to prepare multiple drugs that will be needed during a specific period of time. Use auxiliary labels if additional instructions or precautions are warranted. Expiration dates prevent the use of a medication that has lost its desired strength or potency. Check these dates regularly, since different drugs have different expiration dates.